Presentation today is framed by my own project HIA-IM, which I will explain in more detail later on. It's my pleasure to be here today to speak with you and to listen to your fantastic presentations as well. In particular, I want to thank my colleague, Dr. Francis Sheely and Dr. Janos Giran for the opportunity to present today as part of your conference. So today's presentation, I will talk about health impact assessment. I will talk about health impact assessment and climate action policies. And then I will talk about my own project, HIA-IM. I will then talk about a planned health impact assessment, or HIA, as I will call it, on the Irish Climate Action Plan. And that health impact assessment won't start until 2025, but for today, I'd like to share some insights around the project and the plan to do that health impact assessment, and then some concluding thoughts. So what is health impact assessment? The Gothenburg Consensus in 1999 provides us with a really nice definition that health impact assessment is a combination of procedures, methods, or tools by which a policy program or project may be judged to its potential effects on the health of a population and the distribution of those effects within the population across different sub-population groups. The values underpinning health impact assessment, as outlined in that consensus paper, include democracy, in the conduct of health impact assessment, and ethical use of evidence, equity, and sustainable development. And health impact assessment has been promoted and used as a tool to implement health in all policies across all policy domains, not just health sector, but across the wider social determinants of health. And health inequalities is central to the doing of health impact assessment through its methodologies. And it's this distribution of effects within the population, that's where the connection with health inequalities comes from. And health impact assessment is very much grounded and based on our understanding around the wider determinants of health. As I know that I'm speaking to the choir, basically here today, we're all very much on the same page around climate action and health. Just a few thoughts around the co-benefits. So we know, just like the last speaker was talking about, that the time is now to tackle this climate emergency that we find ourselves in. And it is an opportunity for global health to be addressed and promoted within the 21st century, as is outlined in the latest Lancet report. And this is a really nice infographic. I'm sure everyone is very aware of this around the co-benefits across public health and climate action. And this really is what we need to be promoting with our policy actors in particular, and also what we're hoping to do within the space of the health impact assessment. There have been health impact assessments conducted on climate change policies. What has been found, for example, as discussed in this paper, for what has come out overall is that health impact assessments, or HIAs, foster stakeholder engagement that would not be present if it were not for the health impact assessment. And they provide useful health promoting recommendations based on evidence that have been derived and generated within the health impact assessment. HIAs can facilitate cross-sector collaboration. They can help optimize the health co-benefits of climate action policies, which is really important and what we need nowadays. And health impact assessments raise awareness amongst decision makers and key policy actors of health impacts of those proposed policies. So a lot of the time, or much of the time, there is that lack of awareness amongst key policy actors, which health impact assessment can bring to the table. Okay, I will continue. But if anyone has a question or they want to make a comment, please let me know. Okay, and there's been this nice scoping review of health impact assessment and climate change. And it's a really nice paper. It's a very good comprehensive review. And the conclusion of that review is that health impact assessment, with its comprehensive approach to health, with participation as a guiding principle and the systematic consideration of health and health equity, the step-by-step HIA offers an opportunity to promote health and well-being of climate change, and in particular those affected communities, while paying particular attention to vulnerable or traditionally marginalised communities in the policy process. However, what is needed for HIA to become common practice is for countries to promote more teaching and capacity building in health impact assessment in order to optimise the use of the tool in particular in climate action, and also across a range of policy sectors. There have been many health impact assessments done on climate change policies. What I find to be most significant, and what have, from my reading and my interpretation, and from knowing the people who did the health impact assessments, they've had a great impact on policy, which means that the evidence that was derived from the health impact assessments were used to inform climate action policies around adaptation and mitigation. In Wales, the first one, climate change health impact assessment, and then the health impacts of climate change adaptation strategies for Western Australia, which was done in 2009 and published in 2011. And what the impact of that particular piece of work was that it was integrated into normal practice, and now there is a systematic review of health impacts of climate adaptation strategies, which is really interesting, and I think it's a great model to learn from. So a little bit about my own project. So the project is called Developing a HIA Implementation Model, Enhancing Intersectoral Approaches in Tackling Health Inequalities. The acronym is HIA-IM. It's an ongoing research project. It will run for 4 years until the end of 2026 at this stage, and it's funded by the Health Research Board in Ireland. It is hosted in UCC, in University College Cork here in Ireland, between the School of Public Health and ISS 21, which is the Institute for Social Science in the 21st Century. There's a fantastic group of people involved in the project, as you can see. And maybe I could just point out, make particular reference to the Public Involvement Consultation Group in the center of the screen. So Miss Bernie Connolly is a key participant in that group. She is an activist in environmental justice, and she leads the Cork Environmental Forum here in Cork City. And that public involvement consultation group involves many people who have an interest and are working actively in NGOs and in communities around improving environmental justice for all. And I think this public involvement consultation group provides a great wealth of information and input and contribution to the project, which is really important as we're going on and we're developing our implementation model for health impact assessment. And overall, the project includes many people from a variety of backgrounds and diversity of backgrounds, which is very important in a project like this, which is interdisciplinary and is looking to make that policy and practice impact. The policy context for the project is that we have an endorsement of health impact assessment as an intersectoral approach in promoting health and well-being in our national public health policy, Healthy Ireland. Also within our Sláinte Care implementation strategy and action plan, which is a healthcare and social reform programme. In particular, the Healthy Communities programme aspect of that is where health impact assessment is being endorsed and promoted. In particular, we have local development officers in local authorities and local government in Ireland who are being encouraged to engage with the health impact assessment, either by doing the steps of the HIA or by taking a health impact assessment approach. And there's been an appetite, I would say, at a national level for health impact assessment, a resurgence of interest and appetite in health impact assessments. And because of this, the all-island body, which is the Institute of Public Health, has produced new health impact assessment guidance that was published in 2021. So this guidance from the Institute of Public Health we are using in our project. And the context for the project is health inequalities. It's what we all know. It's the scourge of our time, that people living in areas, in deprived areas, have lowest life expectancy, and people are losing life years because of this. And this is why we need to we need to develop a tool such as health impact assessment, which looks to tackle health inequalities at its core when developing new policies, programs or projects, particularly across all sectors of policy, not just health sector. So the overview of the project is that HIA-IM is a way to understand and explore what happens when a HIA commences, with a view to guiding future practice in Ireland. So I've done an all-island study of health impact assessment a number of years ago as my doctoral thesis. So I looked at 4 health impact assessments and whether they informed local policy or not, and I found that they do inform policy, and not only that, they also contribute conceptually to policy and to future policies developed. So there's a very tangible pathway between health impact assessment evidence and policy being developed. And I also did a study in Slovakia on the implementation of a particular piece of legislation on health impact assessment. I did that in 2010. And now with this project, with that previous experience, what I'm looking to do now is to understand what actually happens when a group of people come together to do a health impact assessment, with a view to looking at ways and strategies for normalizing or embedding health impact assessment into normal day working for different sectors. So in the project, we will use the Irish Health Impact Assessment Guidance. We will use action research methodology with implementation science theoretical framework to explore the barriers and enablers to the use of doing HIA in order to build a model that will, number one, improve future use and implementation of HIA in Ireland. And although the project is funded for the Republic of Ireland, we have the Institute of Public Health Ireland as a key policy actor and as a co-applicant in the project. And they have an all-island focus. So there's a very good and tangible translation of knowledge across the island of Ireland. Number 2, enhance the HIA guidance as it is today. 3, generate key theoretical learnings on the implementation of health impact assessment. And 4, and probably one of the most important, or I would say, is to create a community engagement toolkit to complement the guidance. So what this means is that we want to develop strategies and guidance around how people can meaningfully engage and involve communities within the health impact assessment space. This is not something that's developed in the guidance as it is today, so we're hoping to develop a toolkit that will complement the guidance. It's something that I suppose I'm passionate about. I want to work on making sure community engagement is not tokenistic, but is meaningful. And we have very nice models, in particular, I'm thinking of in Scotland and in Wales in particular, where they have developed HIA and have developed tools and strategies for involving communities that we can learn from in Ireland in this project. This is an outline of the stages of health impact assessment according to the Irish HIA guidance. So for those of you who would be familiar with health impact assessment or even environmental impact assessment, these stages will look very familiar. So they're very similar stages to HIA generally, adopting a lot of the stages as well, and the learning from environmental impact assessment, which precedes health impact assessment. So at the first stage, a screening, you decide whether you're going to do the HIA or not. The scoping is when we scope out the HIA, we decide what health determinants, what population groups are we going to focus on, and clarify the governance arrangements of the health impact assessment, because each HIA brings together a steering group of people. Analysis is where we gather the evidence or generate evidence if that is what is required within the capacities of the project and the health impact assessment, looking at, in particular, at significant effects. And there is guidance within that HIA publication guidance to do that. And then reporting and implementation is where we bring together a report with a view to making sure that the measures that we outline at the very end are those that are aligned with the policy process very, very closely. Otherwise, it is a health impact study, not a health impact assessment, when we don't consider and work very closely with the policy process that we're working with. And monitoring and evaluation is very much looking at the HIA and how were the indicators adopted or not, and why not, and looking at that. So within the project, we have 4 work packages. Work package 1 is action research led design, where we implement 2 health impact assessments, which I'll talk about in a moment. Work package 2 is where we're using implementation science framework to explore how explore factors affecting implementation and the doing of HIA. Work package 3 is where we're developing the community engagement toolkit, and all the work packages and all the data generated will feed into and develop the contextualized contemporary HIA implementation model. And this is a visual of the research model that we're using, very much based on those work packages I outlined just there earlier. In blue, starting at the top, that's where we have the action research cycle using action research methodology. The World Cafe and the Stop and Share are rapid interviews that we do with the steering group who are engaged in the health impact assessments. In the orange, you see the stages of the HIA, and then in between those orange stages, we're also going to be gathering data through a NOMAD survey, which comes from normalization process theory and implementation science theory, and also we'll be doing interviews looking at the factors that are affecting the doing of the health impact assessment, and we'll be doing those interviews with the steering group on the HIAs. And we will do the first HIA on the Cork City Development Plan, which is a land use plan for Cork City in Ireland. And that's next year. So we're starting that in January officially, but actually the steering group has come together. The steering group is very engaged, and there's a fantastic appetite and engagement on the part of the proponent of that HIA, which is the City Council. So they are on the steering group, as well as the Environmental Protection Agency, the Health Services Executive in Ireland. We have good community representation through the Mayfield Development Project, Transport and Mobility Forum, and the Sexual Health Network is on the steering group as well. So we have a very nice array of people on that, and there are 11 on that steering group. So that's a good number of people, because what is recommended in the Irish HIA guidance is 12. So we will be, those are the people on the steering group for the first health impact assessment. And that first HIA will involve community consultation, which we have arranged to deliver in April. And we'll also do a number of workshops and focus groups with particular communities that we want to make sure have an input and voice in the health impact assessment as well, because that's key to the work that we're doing, to make sure that we're combining scientific evidence and literature with community contribution and voice on health impacts that are identified. And then we will do the second health impact assessment will run in 2025, and that will be done, the health impact assessment will be conducted on the Climate Action Plan 2024. So it's retrospective on the 2024 Climate Action Plan. However, with a view to informing policy, there's a window of opportunity every year in Ireland to inform the Climate Action Plan for the subsequent year. So that's one of the good reasons for doing that health impact assessment, apart from the moral and other scientific reasons as well. And I'll just go into a little bit of detail around that Climate Action Plan. But maybe I could preface this description or these insights with, we are yet to do that HIA on the Climate Action Plan. That will be the work of in 2025. So we will do that Climate Action Health Impact Assessment in 2025 based on the 2024 Climate Action Plan. I hope that isn't too confusing. And this is all basically based on the Climate Action and Low Carbon Development Amendment Act in Ireland, whereby we have these plans, which are actually policies, that yearly policies for the rollout of national climate action policy across Ireland. The plan implements carbon budgets and sectoral emission ceilings. It sets out a roadmap for taking decisive action to halve emissions as committed in the programme of government. The Climate Action Plan set out how Ireland can accelerate the actions that are required to respond to the climate crisis, putting climate solutions at the centre of social and economic development. And just to, I had a look at the 2023 plan, and these are the main sections of that plan and policy. So there's a real variety and diversity of actions there, and very much, all very appropriate for the application of health impact assessment. And this is taken from the 2023 plan, which is fantastic to see, because in the previous plan I didn't see such an emphasis on the co-benefits of health. So it's fantastic to see that in there. However, what we hope the health impact assessment will do will optimise on this focus on health impacts and look to synergise across all the areas of action in the Climate Action Plan. So the planned HIA, we will look to develop the steering group at the end of next year, at the end of 2024. We will include, of course, the Government Ministry, the Department of Environment, Climate and Communications. We have some very good people already signed up as well. So Hannah Daly, Dr. Hannah Daly from the Environmental Research Institute in UCC. She is an advisor on climate, energy and on energy policy to the government. So Dr. Hannah Daly has a fantastic insight into the area that we will be very happy to have that contribution and her expertise in the health impact assessment. And for that, and Dr. Ina Kelly works in the Health Services Executive in Ireland in the HSE, and she's a lead within the HSE on climate action. So Dr. Kelly is also going to provide a fantastic range of expertise and insight into who else we can bring on to the steering group. When we bring the steering group together, it is then that we will decide the scope of the HIA, what in particular are we going to focus on, because it's not possible to do a health impact assessment on the whole plan. But what we need to do when we come together as a steering group is to decide the scope of the HIA. And this is the democratic and the participative nature of health impact assessment, and has such a great benefit, and it is such a plus. It would be very important to use the health impact assessment as an opportunity to inform the climate action policy of the subsequent year. So it's very important that we make sure that we are working very closely with the Government Ministry of Environment, Climate and Communications to make sure that the health impact assessment will be most useful to them in developing the subsequent policies. And we're going to, the health impact assessment and the climate action plan will generate very good learnings for the project, because that's at a national level, whereas the health impact assessment on the city development plan in Cork is at the local policy level. So some concluding thoughts. The project is a brilliant space and a fantastic opportunity to explore the conduct of health impact assessments through participants' lived experience. So that is what we're doing with this project, using action research methodology. We're working with lived experience of people doing HIA with a view to improving practice and policy in optimizing health in all policies. So using action research methodology has been done I know that they have done a learning by doing approach in New South Wales and Australia, and in Wales as well in the UK. So there is that precedent, but to the extent that we're doing in this project, it's very novel and innovative. And there's a real energy and appetite for health impact assessment and the health in all policies agenda at the moment, which we're really optimizing and building on in this project. And the way forward is to enhance our work in synergizing the co-benefits of health and climate change, and health impact assessment is one way to do that. Thank you very much.